Okay, good morning everybody. Thank you for joining us on the NHS Grampian Facebook page. Again, we are making a number of our senior managers available for these Facebook live broadcasts during this COVID-19 pandemic, just to talk a little bit more about the response of the organisation to this. You can hear me, but you can't see me. I'm Emma, I'm from the Corporate Communications team, and with me today is Paul Allen, who is our Director of Facilities and eHealth. Paul, thank you for taking the time to join us. You head up a massive and a really diverse team. Can you tell us a bit more about that team and how they're kind of contributing to the organisation's COVID-19 response?
Okay, thanks Emma. So good morning everyone. I think probably first I'd like to thank everybody for the massive contribution that everybody's making, not just to my team but across NHS Grampian and that health and social care, and fundamentally the part that they play at this difficult time is really key to providing that frontline services. So a massive thank you from me for that. The areas I look after, as you say, are quite wide and diverse. So I'd actually wrote a list down here because I'm probably going to end up forgetting. So during this period of real change and reconfiguration within the services, I've got such a wide range of team. I thought I would make special mention of those because they've been really flexible to meet and accommodate those changes. So procurement is a big thing for us at the moment in terms of all the supplies and those key essential supplies coming into the organisation, including PPE. Drivers, warehouse storemen, porters and grounds, facilities help desk, domestic, catering, laundry, decontamination, security, barrier attendants, shuttle bus team, estates projects, learning and development, risk and compliance, eHealth ICT, hospital switchboard, communications, both IT and telecoms, medical records, knowledge and learning and IT service desk. So I've read them all out. You all play a fundamental part in providing those high quality services across Grampian, and for me a massive thank you.
And really, you know, such a massive team, but often so many people that, you know, the general public simply won't see. Catering are working away in the kitchen, switchboard working away in the switchboard rooms. So it is really important that we do highlight the contribution that they've made to all of this.
I would agree with that. Yeah.
So can you pick out a couple of examples, and obviously with such a diverse team we can't cover everything. Can you pick out a couple of examples of what contribution the teams have made to the wider organisation response to this pandemic?
Yeah. Thanks, Emma. I'd be happy to do that. So a couple of mentions. I think one of the big things I would make a mention of is the COVID-19 community hubs that have been set up with our primary care clinicians, providing that at distance, remote working, etc. So whether it's the setting up the IT or it's the portering or the cleaning, now 24/7 via those two centres, one in Elgin at the Oaks and the other one is at the Health Village, Aberdeen Health Village. So we've got them set up. That was a huge contribution the team made, and many others, but that was probably worth mentioning. The other one is we set up a couple of test centres across Grampian for people to roll in and get tested and move on. So that took a bit through a projects team to get that set up at short notice. The oxygen resilience within the Forstall campus at a time we're probably needing more oxygen to meet the likely demand as a consequence of the pandemic we're in. We set up a new resilient plant to provide extra capacity and oxygen for the campus, so that's been very timely. It was planned some time ago, but we fast-tracked that so we could get up and running, and that went live last week. And the other one I'd like to mention is the staff dining rooms and with the retail facilities. So in line with the social distancing that came in a number of weeks ago from the Prime Minister, and that policy change, we had to reconfigure how we actually still delivered meals and food and water and refreshments via these facilities, but had to apply social distancing. So we've moved to a takeaway facility now, which allows people to stay within the facility or go somewhere else for their food. But those that would remain within the dining room facility, then they'll be expected to have 2 metres apart, and the tables and everything have been set up for that. So that's probably worth a few mentions within those areas.
And obviously part of your remit also looks at what we call eHealth, what everyone else will call our IT systems. That's been a massive part of your remit, and it's been a huge piece of work for them as well, isn't it, to support people, particularly people working from home?
Absolutely. So within the heart of our digital strategy, there's a number of things we're looking at there, but using digital to support our staff, whether it be admin staff, people working from home, remote settings, and indeed clinicians. So there's a wide range of things we're doing there. So we've rolled out somewhere in the region of just over 300 laptops with associated cameras for desktops as well, and headsets to support Microsoft Teams. So Microsoft Teams, for example, is a collaborative tool that allows you to message, it allows you to audio call, it allows you to video call within meetings set up. We've had that now for a couple of weeks, and quite frankly, I've heard people talk about being transformational. Well, in some respects it has been, but I'm not sure where we would have been in the organisation without it. So having that collaborative tool, and that allows a wide range of staff, whether in the home setting, the work setting, clinicians, to be able to communicate with each other, and also to be able to store files. So rather than send out specific files for meetings, you can actually include it within the invite. And there's files and document sharing, what have you. So very, very collaborative. It was always intended to roll this out, but that was going to come as part of Office 365, including mail and Teams and other things later on in the year. But we felt we needed it now across Scotland to get that communication going. So that's been really quite fundamental and vital in our response to dealing with the pandemic we're currently in. The other one I'd mentioned is the Near Me. So Near Me is it's a product called Attend Anywhere, but labelled as Near Me across Scotland. That allows clinicians to have consultations with patients in a remote setting. So you could be, for example, at home, having a consultation with a clinician in primary or secondary care. What we've seen across Scotland is a massive uptake of this, and I'm pleased to say that NHS Grampian is leading the way around about that, given the size of the board and the amount of consultations. So when I got the report last week, we were over 1,400 consultations with that direct patient interaction, and that's been really valuable. Again, we've had that product for some time, but we've seen probably a 10-fold, 15-fold increase in the last couple of weeks of rolling that out. So that's really fundamental, I think, at this time to support that clinical patient interaction at a time where social distancing is so important.
Yes, and indeed anyone who's been looking on social media will have seen the very positive reaction that patients have had to things like NHS Near Me. It's enabled them to be able to still have contact with their GP, particularly people who have long-term conditions, still have that contact, but to have it safely. And again, with Microsoft Teams, that folk are able to continue working, work with their colleagues, work collaboratively as part of the organisation's response to this, but also do it safely and from a distance. Paul, thank you so much for taking the time to join us today. Folks, thank you everyone who's been watching and liking this while you've been there. This video will be saved, so there'll be a chance for you to catch up with it later. But a huge thank you to Paul for taking the time to take part in this, and just to echo his thanks to the hugely diverse estates, facilities and eHealth team and the work that they are doing. We mightn't often see them, but the work they're doing is absolutely recognised and we're absolutely grateful for it. Thank you everyone for watching.